right. Okay. Let me grab my stuff and then we can start. Okay, let's go.
All right. You're called to a residence for an unconscious subject. Upon arrival at a 5-story apartment building, you notice it's dark from the outside. Law enforcement is on the scene and has declared the scene safe. A young woman is frantically waving you over. As you walk in, you see a younger man lying supine on the steps. He is pale and sweaty and appears unresponsive.
Okay, have my proper PPE. Is my scene safe?
Yes.
What's my mechanism of injury or illness?
Unknown at this time.
All right. Number of patients?
1.
And I would probably call ALS and initiate C-spine since they were found on the stairs. So could have fallen. Anyway, so we have a 25 to 30-year-old patient. We don't know what's going on, and they're lying on the floor, unconscious. What is the responsiveness?
Responsive to painful stimuli only.
Okay. Ow. That didn't sound good. And I guess there's no really chief complaint other than they're unconscious. So what's their chief complaint? Say none?
Chief complaint is unknown.
Okay. Makes sense. Okay, I'm going to check their airway to make sure it's clear.
It's open.
Okay, and I'm going to check their breathing to make sure their breathing is good and good chest rise and fall. How's my patient's breathing?
Normal rate and depth, a symmetrical rise and fall of the chest. Lung sounds are clear and equal bilaterally. SpO2 is 97%.
Okay, so that's pretty high. Let's go ahead and check the skin condition. What's my color, condition, and temperature?
Cool, pale, and clammy.
How's my patient's pulse?
Radial pulses strong and equal.
All right, and any major bleeding?
No.
Okay. We can't really ask, I guess we can ask questions.
Well, as you approach, a friend states that they had been out to dinner and went clubbing. States that the patient had been drinking heavily, but is pretty sure he took his insulin before they went out. Appeared to be acting drunk all night and passed out as she tried to help him up the stairs.
Okay. So I'm going to probably be asking a series of questions to the friends. Would start with if they remember the quality of pain.
No.
Sorry. I need to start with the onset. When the pain kind of started.
About 7 minutes prior to arrival.
Okay, and then the provocation of what started it, and then the quality. How nothing. Okay.
Got nothing.
I guess there's no real pain. Was there pain radiating anywhere that they could save? Severity?
Nope.
Okay. And do they know when this all kind of started?
No.
Okay. I'm going to be asking them what the patient's signs and symptoms up to when they passed out would be.
Equal respirations, skin is pale and cool, lungs are clear and equal, no evidence of trauma.
And then allergies they may have?
I don't know.
Medications they could be taking?
Insulin per the friend.
And if anyone knows if she has he has a prior medical history?
The friend knows diabetic.
Okay. Do they know what they last ate?
We had dinner about 7 hours ago and then have been drinking most of the evening.
And events leading up?
So the friend states they've been out to dinner, went clubbing, patient's been drinking heavily, thinks he took his insulin before they went out, has been acting drunk all night, passed out as she was trying to help him upstairs.
Okay. All right. I think before I start my vitals really quick, I would like to check their insulin levels to see if they're high or low. So does it say anywhere on there of a a glucose meter?
A blood glucose check?
Yes.
25 milligrams.
Okay. So it's pretty low. Okay, I'm going to go ahead and take my normal vitals. Because our patient is unconscious, I would give them an oral glucose, but I would not give them an oral glucose. I would have probably a ALS come to give them a IV of sugar to bring up their levels up. But I'm just going to go ahead and check the vitals to see if our patient's deteriorating at all. Sorry. Okay, 111 over 81.
118 over 70.
Okay, I'm gonna go ahead and check their pulse. Okay, my respirations are 24 and a pulse is 96.
Respirations 12, pulse 108.
Okay. Normally, when I would be checking their, I would probably now check their blood glucose. That suspected, they were told that they have diabetes. So we already checked their blood glucose levels, and they were pretty low. Since we can't give oral glucose, would probably have ALS. Make sure they bring a IV for sugar, and recess this patient every 10 minutes. Make sure to keep them warm, and make sure they have oxygen too. I didn't say that already. That's it. Okay.